Hi everyone, welcome back to Dr. Ho's Healthy Living vlog. Today we are talking all things fibromyalgia. We have a very special guest today. We have Dr. Kevin Rod from the Toronto Polyclinic. Dr. Rod, thank you so much for joining us today. So, can you tell us a little bit about Toronto Polyclinic and what it is that you do there?
Yeah, Toronto Polyclinic is a multidisciplinary pain management center. We believe in multidisciplinary philosophy and patient self-management. That's why we use different disciplines under one roof. That's why it's called Toronto Polyclinic.
Okay, that makes sense.
So we have medication treatments, physical therapy, psychological treatments, group therapy, and different types of procedures that we do, nerve blocks, trigger point.
So Dr. Rod, if someone's in chronic pain, what's the first step that they should do?
They usually go to their family doctor and explain the symptoms, and then they get the referral. The family doctor explains the whole condition with the symptoms and any tests that have been done before. That background information helps us a lot in evaluating the patient. In fibromyalgia, we usually take the history, and the history is usually explaining the chronic widespread body pain. And there's always other symptoms along with it: chronic fatigue, sleep problems, and some mood-related issues. And there are some trigger points on the body that when you have all of these things put together, you come up with the diagnosis of fibromyalgia. Fibromyalgia, in essence, is a hypersensitivity and overreactivity of the nervous system, central nervous system.
So what is the recommended treatment if someone is on the spectrum of pain for fibromyalgia?
The main recommendation today is a healthy lifestyle. The treatment of fibromyalgia is a lifestyle treatment. There is no one medication or one injection that will fix the condition. Our goal is to move patients from passive pain-focused treatment into more of activity-focused treatments. And we ask the patients to maintain a healthy lifestyle, fix their diet. Anything that they say is bad for your heart is bad for your muscle and joints as well. And then there are some medications, there are some medical devices, sometimes self-management skills, and some psychological techniques like mindfulness, meditation can be helpful. And when you put all of these things together, you come with a comprehensive pain management program.
Okay, Dr. Rod, so you talked about healthy lifestyle, healthy eating. I know that there are some bad foods that probably no names some people participate in. Are they really as bad for you as people say?
Unfortunately, there are some food that we call them inflammatory food. Like there are food that can actually cause inflammation in your body. And inflammation is a big part of chronic pain and fibromyalgia. As I said, almost everything that they say is bad for your heart is bad for your muscles and joints as well. They can induce inflammation. I am very sorry.
No, it's not your fault.
But highly saturated fat, anything with refined carbohydrates can induce inflammation, and then it can make the pain worse. And then you have to fight through reversing all of that inflammatory process as well.
Okay, so it sounds like we really do need to be mindful of what we're eating if we're going to start to manage our own pain.
Speaking of being mindful, mindfulness also is a very important component of that whole lifestyle treatment. So proper diet, mindfulness meditation. There are so many websites that people can go. We have a blog called mypain.ca that patients can go into that and learn about self-management skills, mindfulness meditation, relaxation techniques, range of motion exercises. I suggest everybody, as soon as they get up, move all the joints in direction that the joint can normally move. And that can be the range of motion exercise that will get the circulations going. And meditation, proper diet, all of these things together will help the treatment of fibromyalgia.
I love the idea that you are treating the person as a whole instead of just treating the symptoms, and that people need to be active and a willing participant in their recovery. I think that is something that a lot of people should strive to work towards.
Exactly. We want the patient being on the driver's seat instead of being treated passively. We want them to be an active participant in their whole team of betterment for their life.
Well, if you're ready to be an active participant and get in the driver's seat to help manage your pain, please reach out. You can contact Dr. Rod. We've got the information below, and we'll see everyone next time. Bye.
Bye.